So your doctor had mentioned trying out some products, and I like to refer to those as clean nicotine products. So have you tried to quit before?
Well, I mean, I probably haven't taken it all that seriously with quitting, but you know, I've definitely sort of decided that there's been cold turkey times that I was just going to stop, and it didn't work very well. And
so you've already experienced the problem with stopping cold turkey. If you stop cold turkey, your success rate of becoming a successful non-smoker is probably 5% or less. So
really?
It's not a great option. Some people do manage to stop by quitting cold turkey, but not many. You want to make sure that you give yourself at least 50% of that clean nicotine in the form, you want to replace that nicotine with clean nicotine. Okay? So let's say you're absorbing about 2 milligrams per cigarette. You're consuming about 40 milligrams from your cigarettes per day. So a 21 milligram patch would keep you just above that 50% mark. So I think when we look at the 21 milligram patch, there are a couple of items. You have to weigh more than 100 pounds. And
I do.
I think you weigh more than 100 pounds. Okay. You don't have any heart disease or that I know of?
No, not that I'm aware of. You know, at this point, I just had a checkup and it seemed fine. So
so that's good. So you could easily start with the patch. There are some disadvantages to the patch, and one is that it takes about 4 to 6 hours before it starts to work. So if you put a patch on first thing in the morning, it will slowly start to increase the nicotine levels in your system. It'll take about 2 hours before we get some really decent levels, and 4 to 6 hours before it peaks.
I'm guessing I'll get some cravings before it starts to work.
Exactly. So that's part of the reasons why patches are good, or patch is good to give you your baseline nicotine levels, to manage your nicotine use during the day. But it's that startup first thing in the morning which can be a little bit of a problem. You might need something to help get you over those initial cravings.
So can I use something with the patch then?
Yes, you can. You can actually use the patch and use one of the oral products like gum, lozenge, or inhaler.
Oh, I didn't know that. I have a question about the patch. I've heard from people that if I had a cigarette when I was on the patch, that I'll have a heart attack. And you know, it's kind of one of the reasons I've always stayed away from it, because I worried that if I give in, that something awful might happen.
It's not going to trigger a heart attack. The bad news is that because you're a smoker, as you know, it does affect your risk of having heart disease. And that doesn't go away with the last cigarette. That does persist. So we recommend not smoking while you're using these products.
That's good to know, that if I have a slip that I'll be okay. That was really a worry that I had.
Let's talk a little bit about the oral products. As I mentioned before, you aren't getting you aren't receiving or absorbing a substantial amount of nicotine for the first several hours. So you can use the oral products to give your system a little bit of a boost. Okay. Now the patch is actually designed to be worn 24 hours. So you could wear it, put it on in the morning, and then take it off the next morning and apply a new patch.
So I sleep with it on?
You could sleep with it on.
Yeah.
But some individuals do remove it at night, so they're probably reducing their exposure to about 16 hours. So it depends on the individual and how they've responded to the patch, whether or not they're experiencing side effects. The gum, the lozenge, and the inhaler might be a bit easier to use, because you can actually schedule these products and use them just before you'd normally have a cigarette.
Oh, yeah, okay, that makes sense.
So that might be a bit easier for you.
So then it kind of is preventative for cravings and things like that.
Exactly. So if you know that you have a cigarette at 8 in the morning and at 10 in the morning and at 12, you could actually start to use the gum or use a lozenge or even puff on the inhaler. You could start using it about a half an hour ahead, about 7:30, 9:30, 11:30. This gives you enough time to build up your nicotine levels in your system, and at the time you'd normally have a cigarette, you already have enough nicotine on board. The gum is, it's not actually I think it's misnamed. It's not really a gum. It's a matrix that traps the nicotine inside the product.
Okay.
So when you bite down, you release the nicotine. You have to use the gum appropriately. You bite down until you feel a peppery or tingly sensation, and then
Right.
you park the gum. And when you need another
okay.
puff, you bite down again. So you're pulse dosing the clean nicotine, just like you'd
Okay.
pulse dose the nicotine from a cigarette. If you're chewing continuously, you're continuously releasing nicotine, and that's probably what would give you the upset tummy,
Yeah.
hiccups, lightheadedness, dizziness. That occurs when you're just releasing a constant, with a constant flow of
Right.
nicotine. Okay?
Yeah.
So that bite, park is really important. The other trick with nicotine is that, everybody I know who smokes, a cup of coffee and a cigarette, right?
Yeah.
Okay. Everyone, that's their favorite beverage when they
Yeah.
have a cigarette. Unfortunately, it affects the way the gum works. It affects the way all the oral products work. So we usually recommend nothing but clear water while you're using the gum, the lozenge, or the inhaler. Not only is it healthier for you, you get better absorption of the nicotine, and that might actually help your tummy upset a little bit,
Right.
because
Okay.
the clear water is going to help you get that nicotine where it's supposed to be, and
Right.
perhaps reduce some of the side effects. Now, if you're not certain about the gum, because not everyone likes gum, there's also the lozenge and the inhaler.
Right.
Now, the lozenge actually delivers a little more nicotine than the gum does. Not a
Okay.
lot, but just a little bit more, because you're not chewing or biting and chewing to release the nicotine.
Right.
You're dissolving the lozenge in your mouth,
Right.
and that since
So
you
it's sort of
dissolve
steady nicotine from that. Okay.
exactly, and it's complete release of the nicotine from the
Okay.
product. So you get a little bit more nicotine with the lozenge. Usually it's the same sort of thing. You pop a lozenge in your mouth, you move it around. Same requirements when it comes to water.
What about the inhaler? I've heard people talking about these inhaler things lately, and I didn't really know anything about them.
The inhaler is a plastic wand. It's about 2.5 to 3 inches long. It
Okay.
comes apart, and you can insert a cartridge, a nicotine cartridge, into the center, snap it together.
Okay.
Then you just puff on the inhaler just as you would puff on a cigarette.
Right.
Now, there are some advantages and disadvantages to the inhaler. A lot of individuals find it really hard to know what they're going to do with their hands.
Right.
They've got the clean nicotine on
Yeah.
board, but I'm used to having a cigarette in my hands, and what am I
Yeah.
going to do with them? So the inhaler solves that problem for them. It gives them something to hold on to.
Yeah, that makes sense.
So that's a little bit easier.
Yeah.
But that's also a disadvantage, because holding on to that cigarette is also a habit that we want to break. And that's one of the reasons why I think I prefer the patch and the oral products before the inhaler. As I said before, nothing but water. If you take a deep puff or inhale deeply off the inhaler, you can get a head rush off of that. So we usually recommend, light puffs initially until you can judge
Okay.
how to use the product. So with the patch, if we can identify the right strength for you, then hopefully we keep you just above that stage where
Right.
you would have a withdrawal
Excellent.
symptoms. So that's
That's
the goal,
fantastic.
and then you wouldn't have to use the oral products, but
Right.
you would have the oral products if you need them to
Yes.
manage cravings.
Sure. I'd rather have that than have to have a cigarette.
What I recommend to individuals is you've got your baseline nicotine, the patch. You can pulse dose with your oral products, and that should be the way you think of it. You start with your
Okay.
baseline, you move to your oral products if you need it, and hopefully you never take that third step where you look at that cigarette.
Hopefully. Yeah. Yeah.
Exactly.
Thank you.
Okay.